Help is on the way to several hospitals and medical facilities in Nevada, just overwhelmed with respiratory patients. The governor's office in the state is going to be expanding pediatric services with RSV, flu, and COVID-19 cases all on the rise. Madison Kimbrough spoke to several medical professionals across the valley tonight, and she joins us now live near Sunrise Pediatric Care with more.
With the flu season hitting its peak, medical staff across the valley and hospitals are struggling. The Nevada Hospital Association calling on Governor Sisolak for help. Pediatric conditions at Nevada hospitals are unstable, according to the Nevada Hospital Association. With RSV, COVID, and flu cases rising this time of year, staffing is low and overcrowding remains an issue. And Monday, the governor's office telling 8 News Now that they are stepping up efforts to help these overwhelmed facilities. Dr. Eileen Shee, pediatrician at Little Roots Direct Access, says she's pleased that help is on the way.
I think we need it. I think just in any case, just back when we saw COVID and a rise in hospitalization, when you have something so acute, where respiratory illness is taking over and affecting so many kids, it's a very labor-intensive area in a hospital. You're going to need your respiratory therapist. You're going to need an extra set of ears.
According to the governor's office, applications for nursing and respiratory care licenses will now be fast-tracked, since Nevada is a state that does not accept out-of-state nursing licenses. The state will also issue a temporary license to any nurse a Nevada facility deems necessary. Lisa Nicholas, assistant professor at the UNLV School of Nursing, worked in the pediatric care unit for 15 years. Nicholas says while she appreciates that there is attention being given to staffing issues, there needs to be a longer-term fix.
You also have to look at what sort of nurses they're trying to expedite. If you're trying to have the state board expedite new graduate nurses so they can start working, that's not really going to be helpful, because then you have inexperienced warm bodies essentially just taking up room, as opposed to being experienced, helpful nurses that can actually, add to the patient care situation.
As for RSV cases, the Southern Nevada Health District reported 1,800 cases this past November. That's a 200% jump over the same time last year. Reporting near Sunrise Pediatric Care, Madison Kimbrough, 8 News Now.